Welcome back. Today we're exploring a movement pattern that many people in modern societies have lost practice with, the deep squat, sometimes called a resting squat or Asian squat. This is the position where you lower yourself fully, with your hips close to your heels and your feet flat on the ground. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before trying new movements, especially if you have existing joint conditions or balance concerns. Let me explain why this position deserves attention and what regular practice might offer. In many cultures around the world, the deep squat remains a common resting position used while eating, working, or simply waiting. In Western societies, chairs have largely replaced this posture for the past few centuries. This shift in daily habits means many adults lose the ability to comfortably perform this movement as they age. The question isn't whether squatting is somehow superior to sitting in chairs, both have their place. The question is whether maintaining the ability to move through a full squat range of motion offers benefits for joint health, mobility, and functional capability. Research and clinical experience suggest it does. Let's explore what happens when you practice this movement pattern regularly, understanding both its potential benefits and its limitations. Full range joint movement. When you settle into a deep squat with your feet flat and hips low, you're moving your ankles, knees, and hips through their complete ranges of motion. For many people, this is the only time these joints experience their full movement capacity. Why does this matter? Joints maintain their health partly through movement. Synovial fluid, which lubricates joints, circulates more effectively when joints move through varied ranges. Cartilage receives nutrients through this movement-driven fluid exchange. If you spend most of your day with your joints in limited positions, sitting at 90 degrees, standing mostly straight, those joints may gradually lose mobility in ranges you don't regularly use. It's not that this range disappears permanently, but it becomes less accessible without practice. Regular practice of the deep squat helps maintain ankle dorsiflexion, the ability to bring your shin forward over your foot. It practices full hip flexion, bringing your thighs close to your torso. It exercises deep knee flexion, which many people lose comfort with over time. For people with joint conditions, this movement may or may not be appropriate. Some research suggests that maintaining joint mobility through full ranges, when done without pain, can support joint health. Other research indicates that for certain conditions, deep flexion may not be recommended. This is why individual assessment by a healthcare provider is important. If you currently experience discomfort in a deep squat, that's information, not necessarily a problem. It might indicate tight calves, limited ankle mobility, hip tightness, or simply lack of recent practice. These can often improve gradually with consistent, gentle practice. Movement capability and daily function. There's a practical aspect to maintaining squat mobility that goes beyond exercise, functional capability in daily life. The ability to lower yourself to the ground and return to standing without using your hands is a marker of mobility, strength, balance, and coordination working together. As people age, this capability often declines. Research has shown correlations between the ability to perform floor-to-stand movements and various health outcomes. A study published in the European Journal of Preventive Cardiology found that adults who could sit on the floor and stand up with minimal hand support had lower mortality risk over the study period compared to those who required significant support. This doesn't mean the sitting and rising movement itself causes longer life, but rather that it may serve as an indicator of overall physical function. Practicing movements like the deep squat helps maintain the components needed for this kind of functional capability: hip and ankle mobility, leg strength, balance control, and movement coordination. Lower body strength through isometric loading. When you hold a deep squat position, your leg muscles work to support your body against gravity. This is isometric muscle loading, creating tension without movement. Your quadriceps stabilize your knees. Your glutes and hamstrings control your hip position. Your calf muscles manage ankle stability. All of these muscles engage to maintain the position. This type of strength training is different from lifting weights or doing repetitions. It builds what's called static strength and trains muscular endurance. For many people, particularly those who don't enjoy traditional gym exercises, the deep squat offers a simple way to maintain lower body strength. Is it sufficient on its own? Probably not for comprehensive strength training. But as part of a varied movement practice, it provides valuable loading to muscles and joints in positions they don't often experience. Hip mobility and function. Many adults develop tight hips over time, partly because common sitting positions keep hips at 90 degrees for hours daily. The hip joint is designed for much greater range, but if that range isn't regularly practiced, the surrounding muscles and connective tissues adapt to the limited range you use most. The deep squat requires significant hip flexion, bringing your thighs close to your torso. It also involves hip external rotation as your knees track outward. These movements stretch the muscles and fascia around your hips in ways that typical daily activities often don't. For people who experience hip stiffness or tightness in the front of the hips, regular squat practice may help improve mobility. This can translate to easier walking, more comfortable movement patterns, and reduced compensations that might stress other joints. Balance and stability training. Maintaining a deep squat requires coordinated balance. Your center of mass must stay over your feet. Your ankles, knees, and hips must all contribute to stability. Your core muscles engage to control your torso position. This makes the deep squat a practical balance training exercise, particularly for the positions where balance is often most challenged, when your center of mass is low and your base of support is on your full feet. For older adults, balance training becomes increasingly important for reducing fall risk. While standing balance exercises are valuable, practicing stability in varied positions, including low positions like squats, may provide additional benefit, postural considerations. When performed properly, a deep squat encourages an upright torso position. Your spine naturally extends, your chest lifts, and your shoulders settle back. This is partly because you need this alignment to maintain balance in the deep position. This positioning is quite different from the rounded, forward-tilted posture many people adopt when sitting in chairs or looking at devices. Practicing the squat gives your body time in a different postural configuration. Does this fix poor posture? Not automatically. But it does give you practice time in better alignment, which can increase your awareness of posture and strengthen the muscles that support upright positioning. Digestive system considerations. Some people report that deep squatting feels comfortable for digestion or helps with elimination. There are anatomical reasons this might be true. The squat position changes the angle between your rectum and anal canal, which may facilitate easier elimination for some people. This is why squatting toilets are common in many parts of the world and why footstools designed to elevate your feet while using standard toilets have gained popularity. The position also creates gentle compression on the abdomen, which some people find helpful for digestive comfort. However, this is highly individual, and evidence for dramatic digestive benefits from brief squat practice is limited. Circulation and lymphatic movement. When you lower into and rise from a deep squat, you're compressing and releasing the large muscle groups in your legs. This creates a pumping action that may assist with blood and lymph circulation from your lower body back toward your heart. For people who spend long periods sitting or standing still, any movement that activates leg muscles can support circulation. The squat is one such movement, though it's not uniquely beneficial in this regard. Walking, calf raises, and other leg movements provide similar effects. Ankle mobility. One of the most commonly limited aspects of the deep squat is ankle dorsiflexion, the ability to bring your shin forward over your foot while keeping your heel on the ground. Many adults have tight calf muscles or limited ankle joint mobility that makes this difficult. Regular practice of the deep squat, even partial depth initially, can help gradually improve ankle mobility. This has practical benefits beyond squatting. Better ankle mobility supports more efficient walking, helps with stair climbing, and may reduce compensatory stresses on knees and hips. How to practice the deep squat safely. If you'd like to explore this movement, here's a practical approach. First, assess your current capability. Stand with your feet roughly shoulder width apart, toes pointing slightly outward. Try to lower yourself into a squat while keeping your heels on the ground and maintaining balance. Don't force anything. Just notice where your comfortable range currently is. Many people find they can't go very deep initially, or their heels lift, or they lose balance. This is completely normal if you haven't practiced this movement in years. Start with supported practice. Hold on to a counter, doorframe, or sturdy furniture. This support allows you to explore the movement without fear of falling backward. You can also place something under your heels, like a folded towel or small wedge, if keeping them flat is currently too difficult. Lower yourself only as far as feels comfortable. You might only achieve a partial squat initially. That's fine. Hold that position for 10 to 20 seconds, breathing normally. Then stand back up using your support. Practice this once or twice daily. Over time, you may find your comfortable depth increases, your heels can stay flatter, and you need less support. Key form points: keep your feet flat if possible, though it's okay to use heel support initially. Allow your knees to track over your toes, they should follow the direction your feet point. Keep your torso relatively upright rather than pitching forward. Distribute weight evenly through your feet. Important limitations and contraindications. This movement is not appropriate for everyone, particularly without modification. If you have significant knee pain, recent knee surgery, or certain knee conditions, deep squatting may not be advisable. Hip replacement or certain hip conditions may contraindicate deep hip flexion. Recent ankle injury or severe ankle limitations may make this position inaccessible initially. Balance disorders or conditions that affect stability require extra caution and possibly support. Always consult your healthcare provider or physical therapist before practicing this movement if you have any joint conditions, recent injuries, or balance concerns. They can assess whether it's appropriate for you and recommend modifications if needed. Even if you're generally healthy, start gradually. Forcing your body into ranges it's not ready for can cause injury rather than benefit. Realistic expectations. What should you realistically expect from regular deep squat practice? Over several weeks of consistent practice, many people experience gradually improved squat depth, easier time maintaining the position, better ankle mobility, improved hip flexibility, and increased comfort in the movement. These improvements often translate to slightly easier movement in daily activities. Getting down to the floor feels less challenging, picking up low objects requires less compensation, and general lower body mobility improves. What you probably shouldn't expect: dramatic pain relief, significant strength gains from squatting alone, major changes in posture without additional work, or complete transformation of joint health. The deep squat is a useful movement to practice, but it's one tool among many, not a miracle cure. Combine it with other movement practices, appropriate strengthening exercises, and whatever activities you enjoy, integration into daily practice. The beauty of the deep squat is its simplicity. You don't need equipment, special clothing, or much space. You can practice it while watching television, during breaks from work, or as part of a morning routine. Some people find it helpful to practice after walking or other activities when their muscles are warm. Others prefer practicing at consistent times to build a habit. Even a minute or two of practice daily can maintain or gradually improve your capability in this position. Consistency matters more than duration. Thank you for watching. The key takeaway is this: the deep squat is a fundamental human movement pattern that many adults lose practice with over time. Maintaining or regaining this capability can support joint mobility, functional strength, balance, and overall movement capacity. It's not a magic solution, and it's not appropriate for everyone without modification. But for many people, it's a simple, accessible movement practice that supports healthy aging and functional capability. If you'd like to try incorporating this movement, start gradually with support, respect your current limitations, and progress patiently. Your body will tell you whether this practice is helpful for you. If you found this information helpful, let us know in the comments. What aspects of mobility or movement capability are most important to you? Consider subscribing for more practical, evidence-based guidance on movement practices that support health and function as you age. Remember, maintaining movement capability isn't about achieving extreme positions or perfect form. It's about practicing varied movements consistently, respecting your body's current capacity, and gradually building or maintaining the function that supports your daily life. Thank you for being here. Take care of your body through thoughtful, sustainable movement practice.